thyroid cancer is a relatively uncommon cancer, but it is growing rapidly in incidence. The cure rates are very high, the treatments are relatively straightforward and not very toxic, and for most patients with thyroid cancer who have a good stage or a good prognosis, their long-term survival is basically unchanged compared to the general population. So it's a relatively good cancer from a prognosis and long-term perspective. However, it is still cancer, and not everybody is so lucky, so there are cases where things are much more difficult. So we do have this clinical suspicion just from our routine practice here in Toronto that people of Filipino background and Vietnam and other parts of Southeast Asia do seem to be at increased risk for thyroid cancer. And that's kind of a common impression that a lot of endocrinologists and head and neck surgeons talk about, but we didn't really have any good data to support that. There have been a few studies here and there in the literature, including some from Toronto, that have looked at this question, but really nothing definitive. And so we wanted to conduct a large population-based study to be able to really answer that question more thoroughly. So we did our study using longitudinal data from the Ontario Ministry of Health that follows patients over time. And so what that allowed us to do was to take a group of people, basically everybody living in Ontario, and follow them forward to see who developed thyroid cancer and who didn't over time, and comparing those who were immigrants and those who were not. And that's different from previous studies where they really just looked at one point in time and looked at everybody who was diagnosed with thyroid cancer and compared that to the population and who was from where in the population to try and determine the different rates of thyroid cancer in different ethnic groups. So we used a lot of data from different sources. We used the Ontario Cancer Registry, which we used to find people who were diagnosed with thyroid cancer. And we used data from Immigration, Refugee and Citizenship Canada, or IRCC. And that's a very important data source that we have that allows us to identify everybody who's immigrated into Canada over the last 25 years, where they've come from, and we can link that with the other healthcare databases to figure out whether the healthcare utilization or the health risks for immigrant populations are different than they are for the other populations. And then once we found people who were diagnosed with thyroid cancer, we looked at what stage of cancer they had, what type of thyroid cancer they had, how old they were when they were diagnosed with thyroid cancer, and then we followed them forward for any sign of recurrence of thyroid cancer after the initial treatment. So we confirmed our initial suspicions that in fact patients or people who come from Southeast Asia or East Asia are at increased risk for thyroid cancer compared to the general population and compared to immigrants from other parts of the world. We found that the highest rates of thyroid cancer were for people from the Philippines, from South Korea, and from China. And those people from those regions had 2 to 3 times the risk of thyroid cancer compared to non-immigrants. We also found that, in general, most of the immigrant populations that were diagnosed with thyroid cancer were even more likely than average to have a good prognosis based on the type of cancer that they had and the staging of the cancer at diagnosis. And even when taking that into account, we found that East Asians, at least, had a lower risk of thyroid cancer recurrence compared to non-immigrants, although we didn't see that same benefit for Southeast Asian patients. So I think the biggest message that this study provides is that truly people from Southeast Asia, and particularly from the Philippines, South Korea, and China, are at substantially increased risk for thyroid cancer. And so for a clinician or a patient from one of these regions who finds a neck lump or finds a mass on a thyroid on an ultrasound that's done for some other reasons, I think the index of suspicion and the clinical sort of worry about that is much higher, that that's more likely to be a thyroid cancer than we would otherwise think in anybody else. There are guidelines from the American Thyroid Association in terms of at what point should we be looking at biopsy of thyroid nodules, and maybe those guidelines need to be reevaluated and reexamined for people from these regions, and maybe our threshold for doing a biopsy needs to be lower because we do know that they are at substantially increased risk.